Good afternoon. I'm not quite sure what time it is with you there, but good afternoon in Ethiopia. Greetings from Nigeria. And it's a pleasure to be speaking to this meeting today, even though I can't be physically there. So my slides are up. I hope you can see them and hear me properly. Yes. Can we go to the first slide? So I'm going to talk about the UICC and the role it plays or it aims to play in the elimination of cervical cancer. The Union for International Cancer Control is a global body that aims to unite the cancer community, currently made up of over 1,200 members, over 172 countries, and is probably the largest organization, umbrella organization of cancer bodies. And so there are different initiatives that it undertakes, all aimed at reducing the global burden of cancer through advocacy, capacity building, awareness, and so on. In this particular today, we're going to talk about the UICC's role in the elimination of cervical cancer. Like the chair mentioned in the beginning, the call to action was spearheaded by the WHO, was spearheaded by the Union for International Cancer Control, along with partners like the WHO, we mentioned Roche and several other bodies. I'd like to mention here that Nigeria was the only sovereign country that signed up to that initial call to action before it was declared a global state of elimination. The next slide, please. So there have been various capacity building sessions and webinars that the UICC undertakes, but probably the most substantial contribution that we've made is contained in a report that I co-edited along with some other colleagues on the UICC and was reported in April 2002, which gives us a very good insight of the state of cervical cancer and how we can work with the elimination targets we've all been talking about in this meeting to achieve the goals of the WHO. Indeed, cervical cancer is preventable, and if we can only diagnose it earlier on our continent, then we will be able to, as well as going with the vaccination, we will be able to reach a certain stage, if not totally eliminate it. We will be able to improve what we're currently seeing in our countries, particularly in Africa. And this report gave at least 4 key recommendations, which are on the screen now. It recommends that we include cervical cancer services from screening to treatment and vaccination in our universal health packages in our countries. Not all countries have been able to adopt the UHC packages, or should we call it the primary health care, under one roof, and it's decentralized. That is to say, each state needs to have its own program and process by which they will do it. I'm pleased to say that you have our executive secretary in Kebbi State in this panel, and he will be sharing some more discussions about that road to elimination or to achieving universal health coverage in the state. We also need to have national cancer control strategies, robust ones, and not just the plans as we normally do, but to actually implement them, to have costed cancer control plans. Whether health is national or decentralized to the states, it's important that a budget line is provided for cervical cancer, for all cancers. And coming down the line, since this is the one cancer we know that we can eliminate, to provide a budget line that will enable us to screen, to vaccinate, and to provide early treatments. There are lots of global support programs going on, one of which we have is the CHAI program. It's implemented by CHAI, but funded by UNITAID, and a lot of countries have mentioned this as well. And this is very credible, but the countries must also have the political will to include it in their budgets and implement it. Strangely enough, cervical cancer is not a reportable disease in the WHO Afro-IDSR guidelines. And as advocates, I would like to see one of the recommendations from this meeting in Ethiopia is we must keep pushing that it is included. It's only with the right data that we can start to see the level of the problem and then also give the funding and take the necessary steps that are necessary for it. I've mentioned the third or the fourth one in this case, which is to include cervical cancer prevention and screening services in primary healthcare programs. So this report, we've dropped the link in the chat box, and you can access it online. It's very easy to find. My next slide, I believe that would be my final slide. Our Medicaid Cancer Foundation has been working with both the state and national governments to increase universal access to HPV vaccination, particularly for adolescent girls. We also have carried out the pilots, which again is accessible, has been published and accessible online, where we were able to vaccinate girls and facilitate healthcare worker training and working with the community gatekeepers, the traditional and religious rulers, as well as the parents, teachers organization. Our experience from this is that it's a very well accepted vaccine, unlike the common feeling that vaccines can tend to be met with some hindrances or challenges from the communities. I think because of the way in which we went about it, and this serves as a lesson to everyone else, if we prepare properly, working with the PTAs, working with the gatekeepers, they're very important. The gatekeepers meaning the traditional rulers in your environment, the religious rulers in your environment, advocating and giving them the right information that they need about this vaccine, we were able to very easily carry out the school health vaccination program. In fact, what we have been unable to do is to meet the demand that has come out as a result of that vaccination pilot. A lot of parents and even the traditional rulers are calling us to say that you vaccinated one lot of girls. How about the rest? When are you going to come and give them the vaccine? And at the time, we actually did the 3-dose vaccine, which made it more expensive. So we're hoping that now that cervical cancer is a priority on the political agenda, we will be able to, and also Nigeria is going to be one of the countries that are just about starting. I hope we'll hear some more about that. We will be able to continue with our demand generation and vaccinate more girls. I think that was my last slide. Yes, it was. So thank you very much. I hope that the meeting outcome will help us to have more insights and inputs to how we can indeed introduce HPV vaccine successfully across the continent and save more girls and women from cervical cancer. Thank you, Chair. Over to you.